Now I would like to welcome Alana Walczak to the stage. Alana is the CEO of Calm, and she is going to be giving us about a 15-minute overview of ACEs and the importance of addressing them early on in childhood.
And so I have the daunting task of trying to give you an overview of ACEs, adverse childhood experiences, with a huge body of research and information in about 15 minutes. So I'm going to do my best to give you that overview, and then I'll be joined by some esteemed colleagues for a panel discussion after that. So I want to tell you that in the mid-1990s, the CDC and Kaiser Permanente discovered an exposure, and that exposure dramatically increased the risk for 7 out of 10 of the leading causes of death in this nation. So is that a pesticide? Is that an environmental chemical? What was that exposure? Well, if you did your homework and you know where you are right now, you can probably guess that the exposure is childhood trauma. And that was pretty staggering research and an understanding that they learned about. But what kind of trauma are we talking about? This isn't, a child falling off their bicycle and scraping their knee, or it's not losing a basketball game. It's a kind of trauma that's so pervasive that it quite literally gets under the skin of that child and changes their body, changes their physiology. So let's see if this works. Hooray! So there are 10 documented ACEs, and the first 3, physical, emotional, sexual abuse, physical or emotional neglect, or then there are 5 that really relate to issues facing the family or facing the household. So that's mental illness, incarceration, or substance abuse of a family member, primarily of a caregiver for a child. If there is domestic violence or family violence in the home, or if there's parental separation due to divorce or death. And I'm adding these weren't tested in the original study, but these are some additional adversities that I'm bringing up because there's a lot of local context for these issues. So bullying, institutionalized racism, homelessness or housing insecurity, community violence. Our community unfortunately has experienced several mass shootings and some other tragic incidences of violence that have created many issues of trauma for our young people, but also for families. Lack of food or food insecurity. Immigration is not on the slide, but immigration is an issue that's facing our local community pretty significantly. And then the last on the list, of course, as our state, I think there's 14 fires burning tonight throughout the state, might be more. And then we've had fires and debris flows and mudslides, and we've lost lives in our community, and those lives were connected to other lives that have really created some traumatic experiences for children and family. So the original adverse childhood experience study was done, as I mentioned, in the 1990s by the CDC and Kaiser Permanente, and they interviewed about 17,500 individuals. So these were middle class, primarily white, insured individuals who had health coverage. And they were able to ask them, they were adults now, and they were asking them about their experiences in childhood. And so they created a screen using those 10 documented ACEs that were just on the screen a minute ago. And for every one that you had, you got a point. And so when you got through the 10, however many of those experiences you had in childhood, that was your ACE score. And so then they knew these folks now as the adults, and they had access to their health data, their health information. So they were able to correlate their childhood experiences with their present-day adult health outcomes. And what they found was pretty striking. The first thing is that ACEs are really quite prevalent in our society. 2 out of 3 of us have at least one ACE. And on the right side, you'll see that nearly 50% of children have one ACE. So that's infancy through age 18. So if already in that time period, they already have 50% of children have an ACE. And again, ACEs are pervasive, and this original study was done of white, middle-income, insured families. And so you can think about if you translate this information to families that may have additional stressors, if they're dealing with poverty or chronic racism, the level of stress is just going to go up for those families. But ACEs cut across race, they cut across socioeconomics, they impact Americans and probably globally equally the same. And that 1 in 8 of us has 4 or more ACEs. And that's important because as you have more ACEs, the impacts compound. Because the second thing that they learned in this study is that there's a dose-response relationship. So the more ACEs an individual has, the more likelihood or the more risk for later in life negative health outcomes. So you'll see at the bottom, if an individual has 4 or more ACEs, their risk of suicide is 30 times greater. That's staggering. That's staggering. 11 times greater for Alzheimer's. Double the risk for heart disease, for cancer. We're also linked to stroke, to autoimmune disorders. The list goes on and on of this dose-response relationship. Someone with 7 or more ACEs, 7 of the 10, has 3 times the risk for lung cancer and 3.5 times the risk of heart disease, which is the #1 killer in the US today. And as it says on the right, without intervention, if an individual had exposure to 6 or more ACEs during childhood, their life expectancy decreases by almost 20 years, almost 2 decades. So that's a lot of information to take in. And so what's going on? So obviously intergenerational trauma, there is a behavioral component. So when the stork comes to your house and brings you your baby, the stork doesn't bring you the manual. There's no manual that you get when the baby comes. So how do you learn how to be a parent? You learn because you had parents, and for the most part, we learn how to be a parent based on how we were parented. And so without interventions or without education, there can be a behavioral component to what we pass forward in the generations. But what's quite compelling for me, and I think for my fellow panelists, is that there's a direct link to science, that there's a scientific component of all of this. So one part, and I'm not going to spend particular time on this slide, but this shows you in brain development. On the left, you have a healthy brain firing in all the right places. On the right, you have a brain of someone that spent time in a Romanian orphanage, and you can see that certain parts of the brain just don't light up like other parts, like they should in a healthy brain. So we have Dr. Andrea Ruth will be on our panel, and so I'm going to let the physician tell you all the brain science. But just a couple things that I find particularly compelling. There's a area of the brain called the nucleus accumbens, and that's the pleasure and reward center of the brain. So an individual that experiences repeated trauma, that part of the brain gets stimulated over and over and over, and it's pleasure and reward. So it predisposes that person to have substance abuse disorder later in life, structurally in the brain. There's also the prefrontal cortex. So the part of the brain that's responsible for executive functioning or concentration, what you need for learning. Those that experience trauma, that part of the brain is literally shut down. Activity in that part of the brain doesn't happen. So you think about children trying to listen in a classroom, trying to pay attention to what's going on at the blackboard or what's happening in circle time. Their prefrontal cortex is not firing. It's not working. They're literally biologically not able to focus. And then there's been lots of studies about the amygdala, which is the fear response center, and the hippocampus, which is the area that processes emotion and stress. And what we've learned in individuals who've experienced trauma, those are overactivated. So things that a person without a trauma narrative would not find threatening, for someone that has an overactive amygdala, they're going to have a stress response. So again, think of a child in a classroom or at their locker, and someone walks by with maybe a slightly different face than a smile. They may perceive that as a threat. I may not, but someone that's actively experiencing trauma might perceive that as a threat, might hit that other kid, and then get sent to the principal office and then gets expelled. But it's because their brain is processing that stimuli in a different way. So the other thing that I think is really compelling, and this is where the science really started to be interesting to me, is that it doesn't just influence the brain and the brain development, it influences hormone systems and immune responses. And so this is exactly why, if you think about it, why ACEs later in life can lead to heart disease and cancers, because it's changing the hormonal systems and the organ systems. So one of the biggest advocates for this issue of childhood trauma is a woman by the name of Dr. Nadine Burke-Harris. And so many of you have probably heard of her. She's a pediatrician by training, and she was recently appointed California's first Surgeon General by Governor Newsom. And the topic of ACEs is her national focus. And she describes the fight or flight response. So she uses the example of you're walking in the forest and you turn a corner and you encounter a bear. So your body is biologically, physiologically set up to either fight that bear or run from the bear. And so your body takes over and it sends the stress hormones of adrenaline or cortisol through your body so that your pupils dilate, your heart starts to race, you're ready to go, your palms start to get sweaty, all the things that you've experienced this, like when you have to slam on the brakes so you don't hit the car in front of you. You have that response, and that's because your body's releasing those stress hormones. But if that response is happening every single night for you, because when your dad comes home, he's an alcoholic and you're not sure if he's going to be sober or not, or if he's going to beat you up or beat your mom up. Or if you're not sure if your mom is going to get picked up that day by immigration and you're going to come home and there's going to be no one to be there. Or your grandfather is so depressed that he can't get out of bed to take care of you and you have to raise your 5 siblings on your own. Whatever that situation is, if that stress response is going through your body every single day, that's maladaptive. It's no longer serving a positive function. And then think if you're 5 or you're 10 or you're 15 and your body is not done developing, having those stress hormones pummel through your system is not a good thing. And so this is why scientifically it leads to disease and disorder later in life. Whew, I get so excited about this. So this shows you that, so you're experiencing all of these issues in childhood. You're likely not having symptoms in childhood or adolescence, and sometimes even into adulthood. Sometimes adults don't ever show symptoms, but others do. They are predisposed to disease or disability. And I'm going to talk to you a little bit about how we can change the trajectory in folks. But this science and this issue seems really overwhelming, right? So if you have ACEs, you're just destined to have heart disease, you're destined to have lung cancer. But no, that's not true. There's a lot of hope because we can learn different strategies when we become adults if we've had these experiences in childhood. So adversity is not destiny. With resilience, which is really the skill of being able to bring yourself back into equilibrium no matter what crisis is in front of you, with resilience practice, you can counteract and buffer the effects of adversity. You do have more risk. There is more risk. It's in your body, and there's a great book called The Body Keeps the Score. If you've heard of it, if you've read it, It's all in our body. So how we take care of ourselves really has a lot to do with how it turns out at the end of the day. Our friends in Carpinteria, so as was mentioned by Michelle, CALM received a grant to embed therapists in the pediatric clinic, following the groundbreaking work of what's being done at the neighborhood clinics. The CARP Public Health clinic is now the second place where we're blending behavioral health and physical health. But they created this handout of the 8 components of care, of really emphasizing resiliency. So not only can you as an adult teach your brain new things and actually reformat neural pathways. You can do that. We know so little about our brains, but our brains can create new neural pathways even if we've experienced adversity. But simple, and I say that because sometimes sometimes I don't sleep very well. If I'm not getting quality sleep, I'm not rebuilding my resiliency factor. But good sleep, healthy nutrition, exercise, supportive relationships, mental health supports if it's needed, mindfulness, those 6 are ones that Dr. Burke-Harris talks about in her book and in her work. And then Carpinteria added in financial stability and knowledge of parenting in their work in supporting families. If they don't have those 2 things, how can we really expect families to be resilient? For children, the most important buffering, if they are experiencing trauma or they have experienced trauma, is a connected relationship with a stable, trusted adult. So in our agency, our the CALM tagline is protecting the most important relationship in the world, that between parent and child or between caregiver and child. Could be a teacher, it might be a therapist. Some children don't, unfortunately, have someone in their family. But if a child has that connected, stable relationship, it can transform their trajectory for the rest of their life. So I just want to leave you with this little balancing of adversity with resilience. You can't choose who you're born to. You can't choose the life that you are living when you're 3 or you're 8. You're a child. You don't have choices in that way. But you can learn later in life to add in positive supports to counteract the adversity you've had earlier in life. And so as we transition into our panel discussion, I'm going to be joined by others on the stage, and each of us is really working to assess adversity for families, but then also really encouraging and supporting the development of resiliency. And what we're working on is trying to build trauma-informed or trauma-responsive schools, trauma-informed, trauma-responsive medical centers, and really the concept of being trauma-informed as a community rather than looking at a child who might be acting out in a school district or looking at a parent who does not know how to console her infant at a well baby visit. Instead of looking at them and saying, what in God's name is wrong with you? Asking the question, what happened to you? And then building and starting from a place of empathy for that person's experience, and then listening and leaning in and helping them to build resiliency. If we did that systematically across this county, we can transform the landscape of our county. So that's what we're going to spend the rest of today talking about. So I'm going to turn it over to Michelle.